Now we are going into cardiac axis. What is cardiac axis? All the electrical activity, what is happening in the heart, you make vectors of those and add up everything. There is a vector which comes up in this way. The sum total of the electrical activity happening in the heart is known as cardiac axis. Cardiac axis, as shown in this picture, in this direction, it is towards the lead 2. So lead 2 will be positive, anything around it also will be positive. Remember that exactly opposite to lead 2 is AVR. So AVR always remains negative. Despite if it is an right axis deviation or a left axis deviation, it never goes and 120 sorry, it never goes and 180 degrees deviation so that VR becomes positive. In very rare conditions like an monomorphic ventricular tachycardia, it can become positive. So in life-threatening tachyarrhythmias, it can become positive. Otherwise, in most of the conditions, it remains negative. For this particular reason, AVR is usually seen as a first lead to see whether it is negative or positive. If it is positive, usually it is because of interchange in the limblets. Limblets are not been attached correctly. Because of that reason, for example, right limblet is been attached to the left hand, left limblet is attached to the right hand, then AVR becomes positive. So seeing AVR first to see whether the limblets are attached correctly or not will be helpful if you're not confident on the nurse who has taken the ECG. Now this is the normal axis what we are talking about. So we have lead 1, 2, 3 in this position. All remain positive when the axis is normal, when the cardiac axis is normal. If the cardiac axis moves towards the lead 3, that is moves towards your right side, moves towards the right side of the heart, 3 becomes more positive. It is moving away from 1. If you see here, it is moving away from lead 1. If it's moving away from lead 1 towards the lead 3, that happens in right axis deviation, then lead 1 becomes negative. A negative lead 1 and a positive lead 3 is how you need to find out and right axis deviation. What about left axis deviation? This is the normal cardiac axis. It is moving towards the left side of the heart. Lead 1 remains positive. Lead 3 becomes negative. Lead 2 also can become negative. If lead 2 also has become negative, then we call it as a significant left axis deviation. Okay, so in significant left axis deviation, lead 1 remains positive because it is moving towards it. Lead 2 and 3 will become negative.